So when people are coming to you with tension in the bottom of their foot, plantar fasciitis, posterior tibial tendon dysfunction, tension in their feet that's causing bunions, heel spurs, you're trying to get them into IASTM or Graston at physical therapy, this thing does the same. Now, if you think about foam rolling moves with the tissue. That's the same as a lacrosse ball, the same as a frozen water bottle, and research has proven that that's not necessarily effective. What does work is Graston therapy, or IASTM, instrument-assisted soft tissue mobilization, something that stays still and the foot moves over the top of it, or the foot stays still and this moves over the top of it. So we're creating friction with this device that will help decrease adhesions. Yes, it promotes blood flow, but it's taking away that pain response. People with plantar fascia dysfunction, plantar fasciitis, have pain or discomfort due to adhesions, due to scar tissue, and this can help break those adhesions down and increase the tolerance of the tissue to stress. So if we look at the design features of this, you'll see first off it's got two beautiful ridges on it. The lower bullnose one is a little bit flatter. You can really get into big areas of tissue with this and decrease that pain, decrease that discomfort, and increase the tolerance to stress. So you start with working either your heel or the area of your arch that's painful on the inside of the lower of the two peaks. It's slightly flatter, more bullnose, and you can just slowly work through that tissue. You can either use it as an acupressure device, or you can use it as an IASTM device. You start on the lower area, and if you've got a pinpoint area that you really want to get into, you can use the higher, slightly sharper edge as well. Now, patients place this on the floor. So if you look at the bottom, there's a nice little arrow here, and that tells you to push this out. Think of a Christmas tree stand. Extend those legs, or an umbrella stand. Extend those legs, you put this onto the ground, and it sits there, increasing the surface area with these legs, and the patient can put their foot on top and massage either on the lower or the higher area. You'll see that we have a golf ball texture, and that's so that you can apply some form of balm so that this doesn't create too much friction on your foot. You put a little bit of balm on your foot, and then you start working on that tissue on the bottom of your foot. You will feel after a period of time that that tension starts to dissipate. Everybody that uses this the first time goes, oh, in a good way. It's a really aggressive massage that you again can tolerate and increase or decrease on your own. The accumulation of breaking down the tension in your foot will reduce the pain or discomfort over a period of time. Now, if we're looking for differentiators between this and a frozen water bottle, this and a lacrosse ball, this doesn't move. We need to go back to that point. So you are creating friction against the tissue, like a massage. You are not moving with the tissue, like a lacrosse ball or a golf ball. As we know, there are different layers of tissue in all aspects of our body, but in the foot particularly. So if you think on the skin on the outside, and then you have various layers of tissue as it goes. When you are grinding against this and moving the tissue against it, it helps those layers of tissue to move independently rather than being stuck together. Sometimes people will say that there's adhesions in tissue where those layers of tissue get stuck together and they're not necessarily moving and allowing their independent function to be achieved. So if you move your foot over the top of this device, if it's on the floor, and decrease those adhesive tensions or adhesions in your foot, you can allow those areas of tissue to move independently and to perform their own functions. Research has indicated that Graston therapy, or IASTM, decreases adhesions and decreases pain discomfort in tissue that is dysfunctional. 2 to 3 minutes a day will decrease that tension significantly over a period of time. When you're finished using the device, it's super compact. You just push these back together, slide them back in, and then into your gym bag, your kit bag, your work travel bag, whatever kind of bag you've got, it goes, and away you go, ready for use next time.